Now to a Target 12 Investigators exclusive hidden dangers. State health officials are confronting a new threat in the world of illicit street drugs.
Data shows overdose deaths have been on a steady decline since 2022, and fentanyl is still the leading driver of those deaths. But new powerful additives and synthetic opioids are emerging in the drug supply across the region.
Target 12 investigator Alexandra Leslie joins us now with more details.
For the last 10 years, a veterinary sedative called xylazine has been appearing in the illicit drug supply in the U.S. But more recently, another powerful veterinary tranquilizer called medetomidine has also been detected, and it's over 100 times more potent than that.
There's risk every time you're using substances.
Dr. Rachel Whiteman is a consultant medical director at the Rhode Island Department of Health. She's also a practicing physician and serves as the director of toxicology and addiction medicine for Brown Emergency Medicine.
We see all different sorts of folks from different walks of life that experience adverse effects of drugs.
She says data shows illicit fentanyl has been behind a bulk of Rhode Island's overdose deaths for years. But more recently, healthcare professionals have been seeing powerful sedatives mixed in combination with the opioid.
What we've been seeing is xylazine, and xylazine is a veterinary sedative.
The sedative first appeared in Puerto Rico in the 2010s. In 2022, an analysis from Brown University found that more than 40% of street drug samples tested in Rhode Island contained xylazine. The same year, the Drug Enforcement Administration reported that the rise in xylazine may be driven by its low cost. Ashley Perry, the director of the Overdose Prevention Center in Providence, also believes there's a lower risk of scrutiny because xylazine is not a regulated substance.
We are constantly trying to stay on top of the drug supply.
Perry says when people in the OPC take something laced with xylazine, it's easy to tell based on their response.
Fentanyl is very fast acting. Xylazine and other designer benzos will really put somebody out for hours. So it really is a lot of times about monitoring people for hours at a time.
Whiteman says in the last 3 years, another veterinary sedative called medetomidine has also been appearing in the fentanyl supply, and it's far more potent than xylazine.
We have seen profound, prolonged sedation and overdose, also associated with low heart rate, low blood pressure. And the other thing that's been reported that's concerning about medetomidine and fentanyl is a more severe withdrawal syndrome.
Last year, the CDC tracked a surge of overdoses in Chicago involving medetomidine mixed with opioids. And they noted a significant concern. Naloxone, which goes by the brand name Narcan, did not reverse the effects of overdose in several patients. But Whiteman says naloxone is still critical in the fight against overdoses.
Our overdose messaging really hasn't changed. If you think someone's overdosing, the recommendation is to call 911, administer naloxone. The goal for naloxone is to restore breathing.
There's been progress in trying to combat the evolving opioid epidemic with the rise in sedatives and synthetic substances. I'll have more details on what's been done in Rhode Island coming up new at 6. With the Target 12 investigators, I'm Alexandra Leslie, 12 News.